Okay, you guys, welcome to another episode of I Don't Know What I'm Doing. So, we had to flip this around and try a different angle today. I film in my office, and since I'm not really good at editing and this is all new to me, I was getting this weird halo thing with the sunlight. So, we're trying this. We'll see how it goes. I haven't been on here to make a video in a while because the videos and the updates that I was trying to provide, I felt like were a little bit of rinse and repeat. And while it's all completely valid, I really wanted to make sure that I was providing insight to very different parts of the journey. So it took me a minute before I got here to feel like I had something new and valuable to share. So here we are. Today's topic is really two themes that dovetail into one another, and the first is information overload, and the second is how to pick your surgical team. So information overload. So I'm a firm believer that knowledge is power. I think that when you are well informed, it helps you make a good informed decision, right? You have a good handle on what it is you're trying to make a decision about, albeit anything, right? Travel plans, medical decisions, buying a house, buying a car, going to the grocery store, like whatever. Um, I think you need information to a certain point. But in this journey and during this process, too much information can really be a detriment. In the last couple of weeks, I have really been on information overload. It's been about 60 days since I found out I'm a BRCA1 carrier. And in that time, I have done a shit ton of research. I have been in chat groups and support groups and trying to figure out, all the details around the surgeries that I'm going to have. And to a point where it was pretty much starting to be detrimental versus beneficial. And I really wanted to share that because I think that so many of us, we want to know, we want to figure it out, we want to be able to be informed enough to make the best decision possible for what we're about to go through because they're big things and there is sort of no turning back once you go down this road. So it is important to be informed, but there's a point at which it kind of pivots and turns, and then that information is no longer really good information. And what I mean by that is, for me, again, BRCA1 carrier, I'm going to have a prophylactic bilateral double mastectomy, and then I am going to have a hysterectomy. Um, the the double mastectomy I'm going to have is with deep flap reconstruction. So I have been reading a lot about this type of surgery. It is a very big surgery. It is 9 to 13 hours. There is a lot involved in it. And it got to the point where everything I was reading was no longer informative and beneficial to me in explaining to me the procedure and everything else. It started to be a lot about everything that could go wrong and the worst case scenarios. And then all of my conversations with, my man and a couple of good friends was, oh my God, what if it fails? Like, what if the flap fails? What if the blood vessels don't take? What if I'm completely numb? What if I have problems with anesthesia? What, on and on and on. And everybody was like, whoa, you're not there yet. Like, let's not think about everything that could go wrong. Let's focus on the things that can go right. I really realized that the information I was taking in was kind of all the negative information. I wasn't really seeing a lot of, the positive stories of everybody who had a really successful surgery, everybody who loved their results, everybody who came through it with flying colors, And so it really took me aback. My man actually said to me at one point, he's like, you need to back away from Google. You need to not look at your chat groups. Maybe you should skip a support group this week and just take a minute, right? Kind of an information timeout. And I did. And it was really, really helpful. It was really helpful for me to sort of just hit pause, because the things that we're going through on this journey are really big. They're really scary. Yeah, there are risks. There could be complications. Again, same thing I keep talking about. We're taking away body parts. Some of them we're rebuilding, some of them we just don't get back, right? And there's changes that come with that. There's physical, mental, and emotional changes that come with that. So when you're taking in all this information, when you're trying to prepare yourself for what's about to come, I think there is a point where you just need to hit pause and walk away. And so what's worked for me is, now I kind of feel like I have the basics. I know the surgeries that I'm going to have. I know, the type of reconstruction I'm going to have. And then now I just kind of made a little bit of a list of what don't I know and what do I need to kind of look into. And so for me now, that is what happens post surgery. What can I expect in terms of those first 2 weeks of being home from the hospital? And, what does it look like from an exercise routine? What does it look like from a diet routine? To help me kind of separate out some of the bad shit that can happen, right? Because there is bad shit that can happen, but I don't want to focus there. And I want to get away from the mountain of information and the avalanche of information that can come. I think that was okay for me in the beginning. But like I said, I think it gets to a point where it can be too much. Um, so I share that with all of you because I think sometimes we feel a little bit, or at least I felt a little bit, not in a panic, but like, I need to know all I can know so that I can make a decision. And I think sometimes drinking from the fire hose isn't really an effective way to go about this process and this journey and where we are, because this journey brings its own level of anxiety and fear. And I think, just kind of giving yourself a little bit more space and grace with figuring out the information is the right thing. So that's kind of the first portion of this conversation, is just the information overload, and being able to, I think, distill it down into some bite-sized chunks rather than trying to take it all in at once will really help you in assimilating the information and turning it into action, right? Because ultimately we want to get to a place where we feel confident in the choices that we're making so that we can make the decisions themselves and actually get to the thing itself, which is doing surgery. So let's talk about picking your surgical team. Holy shit, you guys. Like, this is the most complicated and challenging thing I think I've had to do. So we're talking about removing breasts, removing my female parts, and finding a surgeon that I feel like is going to do a good job, is going to both take care of me, in the surgery and be qualified for that, right? Obviously, they're all qualified. They're surgeons, they have their licenses, all of that, but that really specializes in some of these things that you're about to go through. So for me, BRCA1, my age, all of that. So for me, I'm going to have a full hysterectomy. It makes sense, given I'm close to the end of menopause, and, why take out just the ovaries and the fallopian tubes and then have to come back later, potentially take out the uterus because I have fibroids, right? Fuck that. I don't want another surgery. So just take it all. That being said, right, having to talk to an oncologist, gynecologist, instead of your regular OB. Now, there are plenty of OBs out there that can do the job just fine. But in the information that I've read, right, information overload, and in talking to my doctors and everything, it is recommended to actually deal with an oncologist, gynecologist, because you are a cancer gene carrier. when they're doing the surgeries, they also want to look around to see if you have any sort of pre-cancer or stage 0 cancer. Yes, there is a stage 0 cancer. While they're in there, they're doing this. So I talked to one. She was great, super well qualified, highly recommended, you know, amazing credentials. Didn't connect with her at all. Don't know, didn't give me the warm and fuzzies. And I don't need you to be my best friend, but I also need to feel like you give a shit about what I'm going through and that you're taking out my body parts, right? So didn't really connect with her. So now I have, I'm meeting with one other gynecologist this week, and then I have one in 3 weeks. So a total of 3 to figure out if they're the right person. I have met with 2 plastic surgeons, about to meet with a third. I've met with 2 breast surgeons, about to meet with a third. I have a phone consultation with a nerve specialist in a week to talk to him to see if he's going to be part of the team. Like, it's kind of like, how many licks does it take to get to the center of a Tootsie Roll Pop? Like, how many surgeons do I need to talk to feel like I have the right team? And, oh, fun fact. So this isn't like you get to pick your team. Like, I like this doctor over here and this doctor over here. All of your surgeons have to work together in this process, especially when you're doing direct reconstruction. So my breast surgeon has to work with my plastic surgeon, and my gynecologist now doesn't necessarily need to work with them, because at first I thought I was going to do a big bang, meaning the mastectomy, the deep flap reconstruction, and the hysterectomy all at once. No, that is now off the table. I'll be doing 2 surgeries, but you need all of your teams to work together, because they're all going into sort of the same areas, and they need to do this sort of delicate dance, right? So if you like one doctor in your network, but you interviewed a doctor at another hospital and you like them, but they don't work together, that's a problem, right? So hence you have this sort of Tetris-like situation with trying to pick your surgeons. So it is again, I'm going to keep saying this. I don't know what else to say, but it is a lot. It is a lot to try to find the surgeon that is sort of your, Goldilocks, like that is your sweet spot of, completely capable of doing the job, feel like they care about you, and 3, give you the level of service and specialize in the area that you need them to. And it has been really hard. So my goal is to make my decision by the 2nd week of March. I have 8 more appointments, as I said, in these next 2 weeks to wrap up some of my biggest questions and interview some of these new surgeons. And then I have about a week and a half break, and then I meet with 3 more. And then that brings me to the 2nd week of March. And then I should be done with all appointments, all testing. That's the other fun thing that comes with all of this, is there's a lot of testing that needs to be done in between. Lots of blood tests, transvaginal ultrasounds, breast MRIs, lots of fun things. That was sarcasm. That you have to do before you actually get to the point of booking surgery. So picking your surgical team, it is really hard. And so my recommendation for you guys is just to go through it and give yourself a little bit of a timeline. The other thing I would say, which I guess maybe I didn't say a few minutes ago, so it's really important to feel comfortable with the team that's going to be doing surgery on you. Like, don't settle. This is not something that you settle on. You are removing parts. You are having reconstruction. It is altering your body. And I think for me, that is one of the biggest reasons why I am interviewing so many people, right? I don't want to go overboard in the sense of, I don't need to interview 15 people, but I need to interview enough to know that the people that I'm working with, I feel comfortable with. And I will say this, and I've heard a couple of other women say this too, who were at the point of interviewing, I think one woman was at like 8, another woman was at like 10. So they were really high up there with the quantity of surgeons that they had interviewed. And then they had to just step away from it because they felt like part of the reason why they weren't able to pick their team is because they weren't ready. And that's a huge factor. I think that you have to be able to interview your team and know that you feel comfortable with them and you aren't settling. Like, if you really aren't comfortable, trust your gut, right? These are big surgeries. There is no going back. You are altering who you are from a physical perspective, and that is not something to take lightly. So if you don't feel comfortable, don't fucking agree to it, right? But at the same time, if you're finding that you've interviewed 10 people and none of them fit what you need, then I think there is a sense of you aren't ready to make this decision. And so maybe step away from that and then give yourself 2 or 3 weeks, kind of go through all of the surgeons that you've met with, figure out like what it is that you think is missing, and then come back to the table, because you don't want to make a decision before you're ready, and you want to be able to be comfortable with the people who are going to be cutting you open. So I think that that's all really, really important. And those are the things that really came up for me over these last few weeks. And I just felt it important to share because, again, from a provider perspective, we don't have to make a decision right away. We don't. I'd like to say that we have time. We don't have cancer right now. Knock on wood. We don't fucking have it. And that's amazing. And we have this opportunity to have these surgeries and to have a choice. Now, you could screen for however long you wanted to screen and not do these surgeries, right? But the point is that we have more time than somebody who's been diagnosed with cancer. And therefore, you don't really have a choice. You're like, I need to fucking live. So, what do we got to do, right? The difference here is really just that we have some time. So take the time, like make a choice that you feel good about, that you are comfortable with, that you are at peace with, because these are big changes, you guys. So take a minute, right? Don't let information overload freak you out and scare you away. Take a step back if you need to. I did. And then, make sure that you're interviewing and you're really picking people who you feel good about. Like, at the end of the day, they can do the surgery. You trust them to give you the outcome that you want. And ultimately, at the end of the day, that you can wake up after surgery and go, I did the right thing, right? Because it would suck to get on the other side and be like, I made a fucking mistake. So, yeah. So that's what I'm shooting for. I am shooting for being able to make these decisions, finding my right team, and being able to wake up on the other side of this grateful. So, yeah, that's all I got for you today. Have a good day.